Welcome to the deep dive. So you sent over some source material, and we're going to dig into it today.
That's right. We're looking at a pretty specific viewpoint on healthcare systems.
Yeah, focusing on wait times, efficiency,
Yeah.
basically comparing different places based on this source you shared.
And it kicks off with, well, a pretty bold claim, wouldn't you say?
Definitely. The source suggests that certain long waits you hear about in, advanced countries
Right.
simply wouldn't happen in, say, major Indian cities like the metros or Tier 2 cities.
It's a strong statement. And the source uses a couple of examples to back this up.
Okay, let's unpack those.
Yeah.
First, there's the story about King Charles.
Yeah.
The source mentions him having to wait, was it 4 hours?
4 hours, yeah, supposedly in a UK emergency room. That's the UK example it gives.
And then contrast that with a U.S. story.
Exactly. A personal one this time. The speaker in the source talks about their American sister needing a neurosurgeon
Okay.
and facing a 3-week wait just for the appointment. Had to get some temporary online help in the meantime.
Wow, okay. So quite different situations, an ER wait, a specialist wait, but both presented as significant delays.
Precisely. A 4-hour ER wait in the UK, a 3-week specialist wait in the US.
And the source then takes these two specific kind of jarring anecdotes and uses them to make a point about India's major cities.
Right. It basically says, look at these examples. The source contends that these kinds of waits, these specific long delays, will never happen even to a normal person in Indian metros and Tier 2 cities.
So the argument isn't about everything in the system, but specifically preventing those types of long holdups.
That seems to be the focus, yes. The source frames it as these Indian urban healthcare systems feeling much more efficient and much more responsive in that specific context, compared to those anecdotes at least.
It's interesting how it hinges on those particular stories.
It really is. It zooms right in on the King Charles incident and the sisters' wait, these sort of lived negative experiences elsewhere, and contrasts that with a perceived higher responsiveness in urban India for those kinds of situations. It's not claiming across-the-board superiority, just zeroing in on avoiding those specific waits.
Okay, so if we boil down the core idea from this source material, it's basically saying, look at this ER wait, look at this specialist wait, based on these Indian metros and Tier 2 cities are presented as, uniquely good at stopping exactly these kinds of delays from happening.
To the point where the source claims they will never happen there, it's quite absolute.
Right. It really anchors the whole efficiency argument on preventing those specific scenarios highlighted in the anecdotes.
Which leads to a final thought, maybe, based purely on how this source presents its case.
Go on.
How do these very specific individual stories like the King's wait or the sister's wait become the main evidence used to build such a broad comparison about whole healthcare systems?
Yeah. It makes you, the listener, think about what counts as evidence in these comparisons.
Yeah. Exactly. How does focusing on avoiding these particular kinds of frustrating waits, using these anecdotes, shape the entire picture of efficiency that the source wants to paint?
Something to definitely mull over. How much weight do these specific lived experiences carry when we think about the big picture of healthcare efficiency